Record on this community. You were recording.
This tale actually goes back quite a ways. Many years ago, I had a very substantial grant from the federal government to take a look at healthcare delivery as it was managed by county government nationwide. And you may know that there are 3,000 counties in the United States, approximately, give or take a few. There is a National Association of County Governments located in Washington. And so I worked closely with them and I gathered my own data and took a look at, well, how does county government operate across the country and how effective is it? What services do county governments offer and so forth? So I had a very deep background in what counties can and cannot do. By and large, New England counties offer very little in the way of services, in particular health services. The Midwest, on the West Coast, counties are much more active in offering what I would call public health services, broadly defined. So I did this project. It was a fun project. I was glad to do it, and ultimately moved to New Hampshire. And the Healthcare Association, which is the membership association for nursing homes, both private and county, asked me to do a study that compared the effectiveness of county nursing homes and private nursing homes. And what everybody expected was that the private nursing homes were going to be the go-to organizations, that they were going to be providing the best services possible for their counties, and the private organizations would be providing the best services, and the county nursing homes would be providing services at kind of a lower level. Well, we did the study, and we took a look at acuteness of diagnosis of patients, what the average stays were, what the reimbursements were like. We did a full study, and we went to report our results, only they weren't what anybody expected. The county organizations were every bit the equivalent, if not better than, the private nursing homes. The managers of the private nursing homes were, to say the least, angry. To say the least. They expected to be the golden standard, and they were not. So with that in mind, I put my interest in county government aside, and then lo and behold, through no fault of my own, I found myself as a member of the county delegation here in Stratford County. Now, before I got here to this, I had made the acquaintance of a neighbor who happens to be our county administrator. And I also bumped into, so that's Ray Bauer, in case anybody doesn't know Ray Bauer. Ray lives in Lee. And I also met George McGlaris, and thought to myself, gee, he's a heads up kind of guy. I wonder what it would be like working with him. And now, lo and behold, I work with Ray Bauer and George McGlaris on the county delegation. Now, I need to point out to you that all the members of our legislative delegation sit on the county delegation. So Amanda sits on that delegation. And we have some other luminaries. We've got a great bunch of Democrats from Dover who sit. Susan Trelevin sits on that, and Cassie sits on that, and it's quite a long list. Katrina Fargo sits on that, and we're chaired by the chairman of the county commission, and that is Peter Schmidt, who's a very long-term, very savvy, not just legislator, but dare I say, manager. He's just that good. Okay, so by the way, Amanda, you're very good at letting me know when I've gone on too long. So
Sure, keep going.
make sure you do that. So now we can take a look at some of the key organizations that we pay for. And you just found out this week when you got your tax bill how much you are paying for county services. Now, if you looked at that tax bill and you looked at your municipal services, which are really quite small, and your county services, which are minuscule as a part of your tax burden, and then took a look at your school tax burden, you would say, oh my God, the schools are driving me to poverty. How, as I age and as I go into a fixed income, how am I going to survive with what I have to pay for the schools? And one of the answers to that question, my friends, is the county. That small amount of money that we pay to the county is there to help you out in ways that you just can't imagine. So, for example, we run a county nursing home, Riverside Nursing Home. And so Ray Bauer, our county administrator, is primarily responsible for the county nursing home, as he is for the jail and the hospice. And those are the three things that I'm going to talk about. And keep in mind that I did the study of all the nursing homes in the state. And there was no question whatsoever, but that not only was Riverside Nursing Home the best county nursing home of the 11 that are in the state, it was the best nursing home in the state par excellence. And I'll give you just one indicator of that level of excellence. So you know that our nursing homes have to get accredited. So we have state inspectors that come around and do inspections, and the inspection team walks in, often unannounced, okay? They have a checklist of hundreds and hundreds and hundreds of items that they will go through and check. And they will say, okay, what is your nursing coverage 24 hours a day on all of your units? And what is the temperature of every refrigerator on all of your units? And what is the availability of hand sanitizer in every room in all of your units? And the list goes on and on and on and on. It's a nightmare for nursing home administrators. It's an extraordinary challenge. Well, Riverside Nursing Home got inspected recently. And the criterion for success is how many deficits did they find? So I've consulted for other nursing homes. Do I dare say this out loud? I was once called in to inspect Sullivan County's nursing home. And there were hundreds of deficits, just hundreds. And the state threatened to close the nursing home unless they were made up. And we brought in a team of consultants and we buffed and polished them, and we got them past these hundreds of deficits. So about a month ago, it might be 2 months ago, Riverside Nursing Home was inspected. There were no deficits. Let me state that emphatically so that you don't miss, because that's an extraordinary outcome. And I must tell you that I sat in that report and I said to Ray Bauer, you mean to tell me that the state inspectors found 0 deficits? And he said, that's right. And I said, Ray, how often does that ever happen? And he said, it doesn't happen. But our nursing home came up with 0 deficits. Okay, so we know we run a good nursing home. Are they on top of emerging trends in Lee? And that gets very interesting. So, for example, our Lee residents don't want to go into Riverside Nursing Home. They want to stay home. And the question is is our county government adept at keeping them in their homes? And we have a program called CFI, Choices for Independence. And what we do in Stratford County generally, but in Lee in particular, is we provide home health services, Meals on Wheels services, home nursing services, in addition to home health aides, transportation to physician visits, to pharmacies. We provide all of these services to keep people in their homes as long as we possibly can. And we do that because it's a win for everybody. The resident of Lee wins by staying in their home as long as is possible. Riverside Nursing Home wins by the reduced costs of their Choices for Independence program compared to inpatient services. Everybody winds up winning. It's a huge success. And at the same time, we keep our eye, I shouldn't say we, Ray Bauer and his team keeps their eyes on emerging trends, things that you and I normally don't think about. And I'll give you a couple of examples. We now have patients going into Riverside Nursing Home who are morbidly obese. And the nursing home found that they did not have the equipment to lift patients in and out of beds, the ability to get them in and out of vans to transport them. And so the nursing home invested in double-sized beds, hydraulic lifts to move patients in and out, and ultimately purchased a van with a special lift that got these patients in and out of the van for transportation to acute care facilities. Just keeping abreast of what was changing in the health of our population and planning for it in advance. We have a memory care unit. Memory care units are a risk for nursing homes. If a patient somehow gets off the unit and gets out the door, you have a problem. They're disoriented in terms of space. They really don't know where they are. They don't know where they're going. And it is not uncommon for a memory impaired patient to get lost on a winter night and to die. It happens. We used to have a bloodhound to try to track these people. That was marginally effective. And I think, if I'm not mistaken, the bloodhound died, probably of lack of exercise. But so we have invested in, and again, I'd say we, it's the county delegation, it's me, it's Amanda, it's all of your county representatives, invested in a drone with a heat sensor on it so that we can launch a drone over the area around the Riverside Nursing Home to look for human heat day or night. We have trained operators who are available. They can be on site within 20 minutes, launch that drone, and find a patient that is lost. So really, you have to see that the nursing home is watching what future needs are going to be, planning for it now, and dare I say, investing now in the technology that will be necessary. So you're not a naive audience, to say, excuse me, but I got a bad haircut. I won't tell you where I got it. You're not a naive audience. You say, okay, well, this sounds very good, and it sounds like you're a salesman for the nursing home. Are there problems there that are not resolved? And the answer is emphatically yes. We are unable to recruit the nursing staff that we need. It's not just Riverside Nursing Home. It's not just the nursing home industry statewide, it's the entire healthcare industry statewide. We're understaffed, and as a result, Riverside Nursing Home has gone to, I say this with regret, has gone to forced overtime. So you say to your nursing staff, well, I know that you've worked an 8-hour shift. We need you to stay for another 4 hours. We know that somebody's coming in 8 hours from now. We're going to ask them to come in 4 hours early so we can cover the shift. We don't have the personnel to cover. And that is a real problem. We're making a very difficult decision between forcing overtime and paying people time and a half for their overtime versus going out and using contract services, which are much more expensive and much less quality in order to cover those shifts. That's a real problem. We have a union. Our workers are unionized. We negotiate with them. They know the nature of the problem. We've always been able to settle a contract with them. However, our staff is tired, and we don't have an easy answer to that. Okay, so I could bore you for another half hour or so in the nursing home, but I'm going to slide over to the jail, county jail. And now, normally, when you look at county institutions and you look at county jails, you're looking at very high expenditures, very high risk, and almost always poor outcomes. Again, Ray Bauer is responsible for the county jail, and both the jail and the nursing home run in the black. Okay? They do not lose money. Not only that, one of the reasons that your tax bill is so low is that Ray Bauer and George McLaris have been very clever, that's the least I can say, very clever at finding sources of revenue for the jail that are really quite remarkable. So, for example, your friends, the federal marshals, the people who run the ICE program, the immigration policing people, arrest people routinely who are going to be deported. Okay, they're illegal, undocumented aliens. The whole system turns my stomach, but they're undocumented aliens, and they go to jail while they are waiting for their deportation hearings, and then they get shipped out of the country. In New England, they have been housed in Boston at the Suffolk County Jail, very expensive facility, and then they get shipped to Logan Airport, where they get put on an airplane to get deported somewhere else. So our county administrators went to the federal marshals and said, you know what, folks? We'll house your arrested population at much less cost to you than Suffolk County Jail. And not only that, we will provide them a very secure, very high quality residence while they're waiting their hearings. Now, all the feds had to hear was lower prices, and they were interested. So they began shipping their deportees. Again, I'm saddened by the whole vocabulary, up to the Stratford County Jail, where we provide them very high quality dining. It's not food, guys, it's dining. We provide them regular showers, we provide them recreation, and we arrange access to legal services for them. This is compassionate care so far beyond what they would get at Suffolk County Jail, and they are eternally grateful. So what we were doing was we were housing them, and then we had to ship them down to Boston, where they went through the airport in orange and shackles. And our county administrator said, you know, marshals, we have an airport here in Portsmouth. It's 20 minutes ride from the jail we were housing people. Rather than you paying transport down to Boston, why don't you have your charter plane fly into Pease, and we'll get them down to Pease so that they don't have to stay overnight at Suffolk County Jail and go through Logan Airport. And they said, well, you know, we have to be concerned about security. They need secure vans. And we said, we'll buy a couple more vans. And we'll put our sheriff's deputies on the vans. And we'll guarantee the security of the operation. And it'll cost you far less than shipping them down to Boston. And the federal marshal said, you know, great. And what this is it's a win for the county because we get paid by the federal government for housing those incarcerated people. We get paid for it, and we get paid for giving them the highest quality residence that we can possibly give them. Are there problems at the jail? Yeah, there's no question. We're understaffed. We do a lot of training. You can never get enough training done. However, the fact is it's a very, very high quality facility. And my friends, if you're going to go to jail, it's one of the better jails you can go to. Final institution that you should know about, and by the way, I'm winding down with this last institution, so give me about another 6 or 7 minutes. We have on the county grounds the Hyder Hospice. And if you've never been there and you don't know anything about it, this is a wonderful opportunity just to hear a little bit. A number of years ago, a large corporation came to the county and said, you folks don't have a residential hospice, and we would like to build one in your community, and we're looking for some tax abatements, some advantages that would cause us to come into your community. What are you going to offer us? And our county team said, well, how about we give you the land to build on? Unfettered. It's yours. There is just one little thing. You build the facility, and we would like written into the contract that should you decide to close the facility or to leave the county, we will purchase the facility from you for $1. And they signed because they were so sure that they could run this facility at a profit. They didn't do a good job of managing it. They lost money. They decided to close it. And my friends, for $1, your county team purchased a top of the line, top accommodation hospice house that is enviable. It is staffed by a highly trained team of thoroughly compassionate nurses. We work hand in glove with Cornerstone VNA's hospice, and they deal extremely effectively with patients in the last stages of life, managing their medications. I think a really heads-up job of managing medications. I've seen it. I'm very impressed with it. And so here's the bottom line. I'm almost done. The bottom line is that this is our facility. All of these, the nursing home, the jail, the hospice house, these are all our facilities. And should we need them, you and I, they are there for us. It is a remarkable benefit to living in Stratford County, to living in Lee, New Hampshire. As Democrats, we have a real obligation to get the word out and to get the support out for these institutions and to make sure that there is not an elected government that comes in and cuts these resources. Okay. Is that okay?
You're fine. You had plenty of time. Does anybody have any questions for Jeff? Ketron wrote, I wish every single person in Lee could hear this. Well, that's the goal. Once we're recording, hopefully everyone will send it out and everyone in Lee will hear this. Well, Jeff, I have a question for you. I don't know if you mentioned that you are on the executive committee of the county, and can you describe what you do there? Because clearly you're very knowledgeable about this. So how did you get that knowledge? What is your passion, and why did you want to, especially in your first term, go for such a prestigious role?
Well, some of you know that I was at UNH for a very long time, 20 years, and before that I was in medical education and basically community health. So I had been chairman of health management and policy at UNH, and I came into the legislature really at Nada Kayen's urging, because she felt that I had the expertise to bring something to the legislature and to the county. When I first met with Peter Schmidt, who's a very savvy guy, he looked over my credentials and he said, you could be useful. And he said, normally I would never put a first termer on the executive committee, but I think that we can use your expertise. So he put me on the executive committee, and what we do is we are really the watchdogs over budget and policy. And so we, for example, have a meeting coming up on Friday, and we will have a quarterly budget, and we will go over that budget in agonizing detail. And we will ask Ray Bauer, well, there's a 20% increase in fringe benefits for nursing staff. Why is that? And he will justify, why he's spending what he's spending. And you can keep in mind that it's a really tight budget. We do a very, very good job of it. He does a good job of it. It's not we. We compare ourselves to our neighbor counties. All right, now this is being recorded. Can I identify the county? Rockingham County, in contrast, larger population base, larger property tax base. They are not nearly as effective in financial management as Stratford County's county delegation. Much of that is Ray Bauer's work and George McLaris's work, but that executive committee really rides close herd on the budgets. And let me tell you, so we've got Sandy Keene on our committee, on our executive committee, and boy, she has an eagle eye on every item in that budget. So that's what we're responsible for.
Great. Those were my questions. Does anyone else have any questions for Jeff? Oh, one thing you didn't mention, the hospice house. How many beds?
I think we currently have 7.
I'm
not sure of that. It's small, and we're expandable. We can double the size if we have to. That's hard work, I must tell you.
Definitely.
And, there is a sense of elitism at Hyder House. There's a big volunteer organization around it. So we've built a gazebo outside. We've got gardens outside. We've got a brick walkway where people have purchased bricks and had names put on them. But it's hard work. And I think that over the long term, the need for that service will expand. I will add one thing parenthetically. I went to the executive committee and to Ray and said, well, we do just a wonderful job of guaranteeing residents of Stratford County nursing home services, hospice services, um, choices for independence. And it's just fabulous that that safety net is there for us. Can we maintain this long term? And that's going to be a challenge. Some of the things that we have to look at and I'm sliding out of my role as a booster for county government and into the lead Democrats, but one of the things we have to take a look at is the development of taxable properties in our community, because the real estate tax is really our only source of revenue. Somehow drawing young families into Lee, especially families with healthcare professionals, because we're starving for healthcare professionals. And we've really got to be doing our planning now for what our future needs are going to be.
Well, that actually kind of dovetails really well. Katrina actually asked, do we have a recruitment plan for Riverside? And maybe not specifically Riverside, maybe you can say for the whole state. What is the governor doing to recruit those young families and those healthcare professionals to the state in order to help with the aging population?
Oh, I wish you hadn't asked that question. So
Sorry.
our governor, in his wisdom, just vetoed the family medical leave bill. So let's say that you're a young family and you've got not one but two nurses in the family, and you are looking for a place to settle and you want to start a family. And one of the things you want to be assured of is that if you have a child or children, or if you have an aging parent that requires that you take time off from work, that you will be covered for family and medical leave. And we don't have it because our governor just vetoed it. And it was a very short-sighted and foolish veto. And the reason that I say that is when we take a look at an organization like Riverside Nursing Home, if we have to replace a nurse who has had to leave the job because she has a child or he has a child or a parent that needs care or a spouse that needs care, if we lose that person, we have to replace them, we have to recruit to replace, we have to train, and the ramp-up time to get that person up to speed on a unit is months. If we can retain that person on a 6-week family and medical leave, have them back in 6 weeks, knowing what they have to do on the job without having to recruit a full-time replacement, we're way ahead of the game. And not only do we win, but our employee wins and our patients win. And we've lost that opportunity because we have a short-sighted Republican governor.
Why did he veto it?
He doesn't like he alleges that it's based on a tax. And it's really not, it's an insurance scheme. Scheme is the wrong word. It's an insurance plan, thank you. But he says that people would be taxed in order to have this benefit available, and he will not support any form of quote-unquote tax. And the entire Republican delegation is carrying signs that say taxation is theft. And it's a lie. Taxation is the dues that we pay for having the kinds of services that our municipalities and our counties and our state provide for us. And he doesn't get that. So what we have to do is to get Amanda Gord to run against him.
Oh, Jeff, you're funny. No, but they did say in the news, was it yesterday or today, that Steve Marchand's actually thinking of running again for governor. So that would be
I think we'll have a number of Democratic candidates, but of course, as Democrats, we're not stupid enough to put up too many candidates to confuse the populace and to get people who aren't really good candidates in the running. Okay, we would never do anything like that.
No.
But I believe that I think we're probably going to see Andrew Volinsky take a crack at it. I think Steve Marchand, who's an excellent candidate, will probably take a crack at it. And I'm quite confident that Dan Feltus is going to take a crack at it. And any of those three would make a fine governor.
I totally agree with that. Any additional questions for Jeff?
Yeah, I guess my question would be, what can the Lee Democratic Committee do to help market these places, to help make sure that they stay? I don't know. All this information was so great. Now what do we do?
Deb, I think that's exactly the right question for the Lee Democratic Committee. Well said. At every event that we have in town, we've got to have buttons on our shirts that say, I am a Lee Democrat, ask me. And we've got to be conversant with the issues, and we've got to wear that button really proudly and generate the votes here in Lee. I wish that we could take that message statewide. To some extent, we can. We're a Democratic stronghold here in Lee. And we can get the message out in Lee. We are going to have Lee Fair Days coming up September 6th. I know you're all going to be there. We want you to bring your antique cars for the auto show. Anybody that brings an antique car for the auto show, I can guarantee you, if you wear a Lee Democratic button, you will get a prize. I'm one of the judges. But if we show up in force, we can't have a booth, is my understanding. I believe that political booths are not permitted. Is that correct?
Yeah, that's correct, yeah.
But we can wear buttons, and we ought.
But is there a way that at the Lee Fair, because I think the Lee Fair is a great way to get information out, can we have a booth for just information, or how would we get out information about the three things that you talked about today?
There could be a county table, Jeff. You could do that just as an informative kind of resource.
That's a nice idea.
And with Ray being a Lee resident, and if we stay neutral and invite both parties, he would probably be willing to at least provide information, if not take a shift or two.
I'll make sure that he hears that suggestion on Friday. Thank you. That's a great idea. Thanks.
Anything else before we wrap it up?
So last year, I was part of Leadership Seacoast, and we went to the jail and saw a whole bunch of things. It was an amazing experience. You can imagine that we were all up in arms about the ICE people being housed there. And then Ray explained what was going on, and he took us to this room where they were using the money that they got from the federal government to run a special drug rehab program for women. And so we got to talk to the women in the program. It was amazing. And so I felt better about the fact that we as a county were participating in that because of the good things that came or that still come from it. So
Stratford County is a very humane place, and we're bipartisan. Amanda will tell you that our county delegation is clearly split, Democrats and Republicans, and some of the towns are bedrock conservative Republicans, and yet we manage, despite these differences, to care compassionately for our residents and for people who come to us as in the ICE program. And that's a lot to be proud of.
We could
Thank
also, we also, because Deb also mentioned about the drug court and how Stratford County is one of the first counties in the state to actually have provided that kind of service.
Yeah. There are other pieces. So you never think much about our sheriff's department. But if you get to know these people, again, they really are in service to the residents of Stratford County. Our county attorney, and these guys come to our meetings, and we get told life as it is. So our county attorney stood up and said, "Look, folks, we have a drug abuse problem. It's here. I can tell you exactly where it is." And he named the towns. You know which towns they would be. And he said, "You cannot expect us to arrest our way out of this problem. Arresting people and putting them in jail is not going to make this problem go away. We need to be much more creative. We need to have prevention programs in place. We need to have recovery programs in place. And we need to stop blaming people and treat this like an epidemic that we can make a difference in." By the way, thank you for being on the leadership of the Seacoast. That's a great program.
It was a great program.
In chat, we do have another comment about other things we can, as the Lee Dems, what we can do. And it's, what about a session at the library called "Where Do Your County Tax Dollars Go?" People in Lee care very much about their taxes.
That would be fun to do. Count me in.
Great. Katrin can set that up for you. Sorry to sign you up for something. Oh, she wrote on it. Sweet. All right.
I'll stop by the library and mention it to Michelle. Michelle knows not only where my county tax dollars go, she knows where my overdue book fees go. So let me mention, and she'll say, "Well, perhaps we can do this." There's not much of a meeting space at the library. There's the downstairs, but that's a little overcrowded. We might do better at the security complex.
Yes, the safety complex is always available to us. Cool.
But it could be sponsored by the library, or co-sponsored by the library, so it's not political.
Yeah. So just a question. Would you guys want to ask the select board to come aboard also?
Yes. They should definitely be there, and at least they can even speak to where the Lee portion goes, and we can even have Brian there to speak on behalf of the school board and say where those dollars go.
That one's a conundrum. If you look at the demographics, the number of kids coming into the school systems is declining, and our staffing costs and our capital costs are rising dramatically. And the movement now is toward a new middle school. There's a lot of agitation for it. That's going to be a huge bill, and I'm not sure who we're building it for.
So I've actually asked Brian if he will be our guest speaker for next month and to be able to talk about these kind of things. I haven't heard back from him, but I'm hoping that he'll say yes and we can ask him those kind of questions.
Mm-hmm.
But I did read in the, I forgot where, that there's so many new kindergarten students coming in that they have to make a new class of kindergartners.
Really?
Yeah, I forget where I read it. Maybe the Lee Crier? Maybe, I don't know.
Katrin would agree with that. She said she's on the long range planning committee and our numbers have swung back up.
Oh.
Wow. Boy, somebody's not sleeping nights. That's
She says, our population is going down, our towns are not. Cool. Well,
Great.
with
Okay.
that, is there anything else that you want to throw out? Oh, she corrected. Population is going down. Our town's population is not. There we go. That makes more sense.
okay. Well, I'll check with Michelle at the library just to see if there's availability there. Amanda, if you'll check with the select board, let's get working on this.
I can reach out to them. And maybe we can do an update at the next meeting.
Okay.
Cool. Well, thank you all for joining.
Okay.
And yeah, all have a good night.
Good night.
Bye.